understanding the trade-off actually help individual citizens?
Policy corrections that the government might have about these kind of long-term changes in operations.
And actually, when I talk about leadership, this is
So next, we would like to invite Dr. Mwatsama. She is the head of capacity and field development for climate and health at the Wellcome Trust. So please give a round of applause to Dr. Modi.
Good morning, everyone, and thank you very much for the invitation to come and speak today. So I'm going to give a short overview talk covering three areas. I'll briefly introduce you to the climate change agenda globally, talk about why it is Wellcome has decided to prioritise tackling climate change and health as one of its strategic priorities, and then just end with how we're planning to tackle this problem. So I don't have a modelling background, but you'll see in my talk that modelling does feature in helping to solve climate change. Next slide. So just very briefly, for those who don't know, Wellcome, I think most people here will be familiar, but we're a major philanthropic foundation which in 2021 embarked on a new strategy which aims to solve three of the world's global challenges: climate change, infectious diseases, and mental health. We also fund discovery research, which we've done ever since our existence over the last 50 years or so. And over the next 10 years, we're planning to invest £16 billion in solving our new strategy. On to the next slide, please. So the Paris Agreement was a landmark global framework that was adopted by governments who committed to collaborate together in order to solve the world's climate crisis. It was adopted following 13 years of negotiations under the auspices of the United Nations Framework Convention on Climate Change. And it was a landmark because for the first time, governments had made commitments to actually act on climate change as opposed to just talk about it. The governments who signed up to this have committed to do three things. The first is to commit to reducing emissions to align with limiting global warming to below 2 degrees, ideally 1.5 degrees. The second is committing to introduce measures to adapt to climate change. And then the third is to mobilize sustainable financing in order to tackle the climate change crisis. On to the next slide. Unfortunately, this slide highlights the take-home message is that progress towards achieving the climate goals is far from where it needs to be if we're to halt global warming towards 1.5 degrees or below 2 degrees as a minimum. So on the left-hand side, you've got existing policies in action, which is the current trajectory. We're on track to, by the end of the century, global warming will have increased by 2.7 degrees. And even under the most optimistic scenario, on this side, on the right-hand side here, if governments were to implement all their existing policies, both long-term and short-term pledges that they've made, plus implement any policies that are currently under discussion to tackle climate change, if all of the above were to be done, we would still fail to meet the Paris goals that the governments have signed up to. So progress is woefully below where it should be. We're currently at 1.5. We're currently around here, around 1 degree warming above pre-industrial levels, and we're already starting to see the impacts of that through increased things like floods, fires, major disasters happening around the world. So we're already suffering. On current trends, between 2030 and 2050, there'll be an extra 250,000 deaths a year as a result of climate change-induced changes to nutrition, malaria, heat, and other infectious diseases. So climate change is already having an impact at the current levels of warming. If we don't carry on the trajectory we're going to be on, things are going to get even worse. There are also health benefits from acting on climate change. So, for instance, a study by Ian Hamilton and colleagues published in the Lancet Countdown looked at what the impacts would be across 9 countries of tackling 3 of the biggest sectors that contribute to greenhouse emissions. Those are food systems, energy, and transport. And what they found across these 9 countries, which represent half of the world's population, 70% of emissions from these sectors, would be that each year 1 million deaths would be prevented from air pollution, 6 million deaths would be prevented from improvements in diets, and a further 1 million deaths would be prevented from improvements in physical activity. So there's significant co-benefits to be had from addressing climate change on the health side. And those health benefits can also result in cost savings to healthcare systems, increase productivity in the economy, which would help to offset the costs for actually tackling climate change. And that's one of the reasons why we as Wellcome have decided to prioritise this as an issue. Our peers who work in climate philanthropy, also those working in governments and the advocates, have argued that we need a significant injection in action, and health can be a big motivator for governments to act, because both people care about it individually, but then also politically it's easier to solve some of the really significant changes that are needed if there's a health co-benefit to them. And so then on to the next slide. Another way of looking at the climate change, current status of climate change today, is looking at what are the most influential scientific papers that are currently out there in the media. This is an analysis that was done by the Carbon Brief, and what they did is they looked at what the most influential science papers were in climate science published last year. You don't necessarily need to look at the detail, but essentially the top 10 global impactful science papers, which were impactful as measured by the fact that they were most reported in the media, on Twitter, in blogs, also cited in science papers, they were all focused on impacts of climate change. The good news for health is that 3 of those papers with the stars looked at climate impacts on health. So looking at things like what's the impact on climate on infectious diseases, what's the impact, one of them was what's the impact of climate if you switch from coal to clean energy, for example. What this also tells us is that unfortunately there's not that many scientific papers on the solutions for climate change. What are the solutions to help people mitigate climate change by reducing greenhouse gas emissions and adapt to climate change in ways that protect health, for example. So that's a big gap area in the literature. The other thing around the most influential scientific journals is a question of diversity. So 9 out of 10 authors in the top 25 science journals were affiliated with Global North institutions. Less than a third of the authors contributing to these papers were women. So there's a big diversity problem also linked to the global science problem. And this is not just reflected in these most influential papers that were published in Nature Science and The Lancet. It is also replicated throughout the literature. So for instance, a review by Leah Beringford and colleagues used machine learning to assess all the scientific papers out there on science. They identified around 16,000 papers, and just 10% of those papers were focused on mitigation solutions, 7% were focused on adaptation solutions, similar levels of lack of diversity in the authorship. So that's another area where we're thinking about how can we as Wellcome help to increase that diversity, identify solutions that context-specific and relevant in different parts of the world, and also increase the diversity of the influential scientists contributing to the climate debate at the global level. So that finally takes me on to the how of our strategy. And I will end on this basically side, which summarizes our mission in climate change, which is really to put health at the heart of climate action. And we're going to be doing that through addressing 4 main goals. The first is really about generating evidence to understand comprehensively what are the impacts of climate change on health now and into the future. So looking at the impacts on things like how air quality, outcomes related to food and insecurity, disease-related outcomes, malaria, dengue, waterborne diseases, extreme heat and weather events, and also socially mediated impacts through things like migration, for instance. So really quantifying those to help people really be aware of what's coming on the horizon if we fail to act in the way we're currently failing to act. The second goal is really looking at what are the effective solutions which we can promote to help governments mitigate against climate change in ways that maximize health benefits. So looking at those global figures, but then also what are the individual solutions that are best for different countries in different contexts. The third is about understanding what are the effective interventions which can help governments adapt to climate change and in ways that also protect health. And then we have a fourth goal around field building, which is the area I lead, which is really about building a global community, first of all, of researchers who are able to research and understand the climate change problem, facilitate better collaborations between those working in the health sector, climate change, and other relevant sectors that are needed to tackle climate change. But then also supporting policymakers, practitioners, the general public, to be able to understand the evidence that's produced and then use it to put health at the heart of climate action. Our strategy is going to be both top-down and bottom-up. So the bottom-up approach is really going to be about looking at investing in target countries or regions where the needs are greatest to support both the researchers to generate research and evidence on the solutions, but then also support the policymakers and the advocates to be able to use that evidence in order to drive change in those target countries or regions, which are still to be determined. And then the top-down approach will be us using our whole of Wellcome approach, both our research funding that I sit in, as well as our government relations, policy, communications, public engagement teams, to really drive the process of putting health at the heart of climate agenda at the global level, so influencing the top scientists who are contributing to the IPCC that feeds into the UN Framework Convention on Climate Change, for example, helping to raise the voices of different stakeholders in these global debates on climate change to really help drive that transformative change that's needed. Modelling will definitely be a part of it, and I'm happy to talk about some of the examples of things we might be doing in the future. But at this stage, we're here at PMAC to meet people here from different parts of the world, hear about the different needs across research, policy and practice, and really help identify what we can do together to solve climate change. So I'm looking forward to meeting you over the next few days and collaborating together in future. Thank you.